Hello everyone, welcome to our channel. Today we are going to discuss about the rectum under the lesson category of pelvic and perineum.
So in this video, we are mainly focusing about its extension, gross anatomy, histology, relations, blood supply and the lymphatic drainage. Most of our past paper essay questions are based on these topics. So I think this video will be quite beneficial for you. As you all know, rectum is the terminal part of the large intestine. It is a tube-like structure with the length of 12 cm and the width of 4 cm. The lower part of the rectum is quite dilated, so we call it as rectal ampulla. Rectum extends from the level of third piece of the sacrum to the level of tip of the coccyx. More precisely, we are saying it extends from the S3 level to 2 or 3 cm in front of the tip of the coccyx. As I told you before, rectum is a tube, but not a straight one. It's curved tube. Rectum curves both antero-posteriorly and laterally. Antero-posteriorly, there are two curvatures. Upper part of the rectum curves posteriorly due to the convexity of the sacrum. The lower part convex forward due to the puborectalis muscle. As you can see in this picture, there will be a muscular sling around the rectum called as puborectalis muscle. This sling pulls the rectum forward. That is the reason for the forward convexity. And there are three lateral curvatures: upper, middle and lower. Both the upper and lower curvatures convex to right side. Middle one convex to left side. That is the most prominent one. Okay, then let's talk about the histological appearance of the rectum. As you all know, our GI tract wall have quite similar structure. In rectum, there will be a outer fibrous adventitia, then muscular layer with inner circular and outer longitudinal muscles, and there won't be any tinea coli. Then the submucosal layer, then muscularis mucosa, lamina propria. Finally, there will be a surface epithelium with tall columnar cells. Okay, rectum is a tube. So let's see about its internal view. Internally, there will be a transverse rectal folds. They are crescenteric shape. We call them as Houston valves. When we are doing the dissection about the rectum, try to identify these Houston valves because it is a very quite famous question in spot exam. Okay, then let's talk about the relation of rectum. When we are learning about the relation of an organ, I think it's good to learn through a picture. Because you know, in anatomy, there are so many things we have to identify and memorize. So in case of learning relations, I think it's quite beneficial if you use a picture to identify the relations and memorize. So in that case, I also use a picture to describe the relations. First, let's see about the peritoneal relation. In this picture, the green color line identifies the peritoneal covering. As you can see, upper 1/3 is covered by the peritoneum, front and the side. But the middle 1/3 is only covered by the peritoneum in front. And the lower 1/3, there won't be any peritoneal covering. Okay, then let's see about the internal organ which are related to the rectum. In anterior aspect, both the male and female have quite different relation. But in posteriorly, they have same type relation. In males, Anteriorly, there will be a peritoneal pouch called as rectovesical pouch. In this pouch, coils of intestine also contain. Below the pouch, there will be a fascia called as denon-villus fascia. In front of this pouch and the fascia, we can see bladder, seminal vesicle, prostate, and part of urethra. In female, in front of the rectum, there will be a peritoneal pouch called as the rectouterine pouch, and also it called as the Douglas pouch. Below the pouch, there will be a rectovaginal fascia. So in males, there is rectovesical pouch and then denon-villus fascia. Likewise, in female, there will be a Douglas pouch and the rectovaginal fascia. In front of the pouch and the fascia, you can see bladder, uterus, and part of vagina. Posteriorly, there will be bony parts, fascias, and some vessels and sympathetic trunk. What is the importance of knowing these relations? There are some. One of the importance is if there is a rectal carcinoma condition, malignancy can locally invade to related organ. As well as if there is a cancer condition in related organ, it may cause to the rectal carcinoma. Another importance is when you are doing the digital rectal examination. In digital rectal examination, some organs are palpated even in a normal person, but some organs are only palpated in a pathological condition. So, to identify what are those palpable organs, you should have a quite knowledge about the relation. Then let's talk about the mesorectum. First of all, you should know that rectum doesn't have a mesentery. So, what is the mesorectum? Connective tissues and fat around the rectum is called as mesorectum. And also it contains superior rectal artery and its branches, superior rectal vein and its tributaries, and some lymphatic vessels and lymph node. Why we specially talk about the mesorectum? If there is a rectal carcinoma, the malignant cells will be present on the lymph node in mesorectum. So in this kind of clinical problem, we have to do some incision in mesorectum. Okay, then let's talk about the blood supply and the lymphatic drainage of the rectum. First, arterial supply. Rectum is supplied by the superior rectal artery, middle rectal artery, inferior rectal artery, and also median sacral artery. But the main supplier is the superior rectal artery, which is a continuation of the inferior mesenteric artery. Then let's talk about the venous drainage. Venous drainage is correspond to the arterial supply, but the veins of the rectum freely anastomose with each other and form some venous plexuses. Mainly there are two venous plexus, internal rectal venous plexus in submucosa and the external rectal venous plexus in muscularis externa. The main veins of the rectum are superior rectal vein, middle rectal vein and the inferior rectal vein. Superior rectal vein drain into the inferior mesenteric vein, then into the splenic vein, and it will add to the portosystemic circulation. Middle rectal vein will drain into the internal iliac vein, then into the inferior vena cava. Inferior rectal vein will drain into the internal pudendal vein and then into the inferior vena cava. Finally, let's talk about the lymphatic drainage. Lymphatic from the rectum is mainly upward. Generally, we say superficial lymphatic vessels will follow the venous structures and the deep lymphatic vessels will follow the arterial structure. So, the lymph from the upper one-third will drain into the pre-aortic nodes and the lymph from middle one-third drain into the internal iliac nodes and the lymph from lower one-third will drain into the superficial inguinal node.
That's all about the rectum. Thank you for watching. Please like this video and subscribe our channel.